Okay, good morning, guys. So I'm here with Dr. Matt Franzsen, who is a chiropractor, and he specializes in sports. And we've been discussing the NAS Extreme and also the NAS Extreme 0.5. So we've got some quite interesting information to tell you. Well, the doctor has some interesting information to tell you. So, welcome. Thank you.
Thank you. Thank you.
Nice to see you again. Yes.
Thank you.
So you've been a triathlete for quite a while. First of all, you've been
Yeah.
doing this for a couple of years ago.
Yeah.
So
So I raced at a high age group level. I raced and represented SA at long course ITU World Champs back in 2016. Unfortunately, I had some health issues. I've taken some time off since then, and just starting to make my comeback now, and hoping to make my comeback at the NAS Extreme.
Oh, good.
Yeah.
I'm glad you're coming along.
Yes. It's been a long time out of sport, and I've missed it very much, but making my way back slowly and surely and trying to do things properly.
So why this one? It's quite a...
I thought to myself, I've done all of the races that SA has to offer. From all of the road races, most of the running races, I've done most of the tries, I've done our full, I've done all our halves, I've done all of our ultras, I've done all the races, and it gets to a point where it becomes a little bit been there, done that, bought the t-shirt. As nice as it is to race familiar tracks and try and beat your time on familiar tracks, I thought to myself, as a comeback race, I'd really like to do something new and extreme and exciting and different. And there's not much more different than NAS and Extreme. It's a beautiful part of the country, and it's something that I really want to go and do and start this journey again, restart this journey with a new challenge.
Yeah. Oh, good.
I'm very excited.
Yeah, I'm looking forward to you coming down, actually.
I'm very excited.
So then, tell me a bit about chiro. So you deal mainly in the sports side of things.
Yeah. So I am a qualified registered chiropractor in the country, and as part of that, it's no longer are we just the Rick and Plick doctors of old. We don't just do backs. In fact, I do very little spinal work and manipulation of just back issues and back pain, because I specialize in the sports field. In the sports realm, I do a lot of what we call extremity injuries. So I'm seeing a lot of the injuries that the runners, the swimmers, the cyclists, the footballers, the tennis players, all those kinds of things. So we're seeing the muscle strains, the ankle inversions, the shin splints, the knee issues, those kinds of things, the shoulder guys, the swimmers and tennis players. It's a lot of extremity work that I'm doing. And because of my background in triathlon, I'm getting a lot of the triathletes that are coming in, because there's nothing better than having a practitioner that understands what you're going through. Not only from the point of view that I understand what injury you've had, I've had most of them myself, but also how you got them, what you need to do to work through them, and how important it is for you as an athlete to get back on the road. Yeah. There's nothing worse you can do for an athlete than take them out of what they love to do. Especially the guys that are doing extreme distance stuff. We're not so well upstairs, and the minute we pluck them out of that situation, they don't do so well. So it's a fine line to walk as to rehabbing as quickly as you can, getting rid of the issue as quickly as you can, but getting the patient back into sports, or potentially even treating them through their training and allowing them to carry on with what they love to do. Yeah. So with the triathletes, a lot of what I'm seeing, there's a lot of swimming injury issues, there's a lot of rotator cuff issues that we have to work with. With the increase in the use of paddles, and I see the guys at the pool every day with these massive paddles, and they just seem to be getting bigger and bigger and bigger. And I understand the science behind it. We want to get our shoulders strong, we want to get that motion strong, and the paddles also highlight deficiencies in our stroke and problems in our stroke pattern. But it also causes a lot of issues with overloading of the musculature. So we do a lot of work with the shoulder, dry needling into those rotator cuff muscles, taping, rehabbing, strengthening into those rotator cuff muscles. The cyclists, because it's so low impact, it's very seldom that I see major fallout from cycling injuries. Obviously, besides crashes, the cyclists don't really seem to hurt themselves. The majority of the time, if you have your setup correct, and I can't emphasize that enough, if you have your setup properly done by a professional and done properly, you're in the clear, bar you ramping up massive volume very quickly. The runners is where we really start to see a lot of injuries coming through. And this is something that I can talk about for ages, so we maybe need to make another video about it, but forefoot strike running versus heel foot strike running and the injuries associated with the two types of running. Obviously with the track that I've looked at the profile, there's a lot of hills, so that your athletes are going to be doing a lot of hill training, and that loads the posterior chain quite a lot, the back muscles of the leg, the calves, the hamstrings, the glutes. when we're climbing through those muscles, and that causes a whole lot of issues with those. So we see a lot of shin splints coming through, a lot of ankle inversion injuries with guys running off-road, that kind of stuff. So I'm spending a lot of my day prepping the athletes that are going to Nice and Extreme for those kinds of injuries. Those are the things that seem to be rearing up at the moment. So
to keep them, so they're going through the whole, rigmarole of all the training. And I remember I came to you a while back because I also was training for a race, and you said to take some time off, and basically I said no.
Yeah.
So you know what
it's a common conversation that I had.
Yeah. So how do you? So what's the best thing now? So these guys are busy training and everything, and what should they look out for? And if something crops up, what do they have to do?
Yeah.
Should they be rode in correctly? Should they do stretches before?
Yes.
Basically, what do these guys need to do?
Okay. So the most important thing is when you start to increase your volume and your load, you need to look out for the niggles and you need to catch them early. So the earlier you catch something, the better. A lot of the time, what I get is when do I stretch? Do I stretch before? When do I stretch afterwards? When do I heat? When do I ice? And these are all very important questions. And these are things that, if done incorrectly, can be even more detrimental than they can be beneficial. So, for instance, if I pulled a hamstring this morning on my track session, you would go home and you'd say to your mates, listen, I pulled my hamstring, this thing's really sore. And one guy would say, listen, I pulled a hamstring and I put heat on it. My chiro told me to put heat on it, my physio told me to put heat on it, my bio told me to put heat on it, and it really helped. However, the time frame for that application of heat is very important. If you apply heat to an acute injury, so the text varies, but anywhere between 48 hours, 3 days, if you're putting heat on an acutely injured piece of soft tissue, you make it worse. You cause internal bleeding within that muscle, and you slow down the healing process. So that's when ice would be applied. However, days later, when you start to put some stretch into that muscle and you're starting to rehab that muscle, heat is very beneficial. So, to answer your question, identify those niggles early. Generally ice, as a general rule of thumb, in the beginning, ice. So if you've tweaked something, if you injured something, if it's acute, if you've been running and you felt this little ow and not sore, ice is generally the answer to that. And then later on, light stretching. Stay away from the NSAIDs, from the non-steroidal anti-inflammatories. They start to there's a whole lot of literature that tells us that they're slowing down healing more than anything else. Yeah. So don't take them if you don't absolutely have to. Use ice to control inflammation. And then later on, you use heat to increase blood flow. Remember, blood carries everything that we need to heal. So you want blood to come to the area when the area is ready for it. And it brings in all of those things that we need to heal the area. Stretching, warm-up, very, very important. And I mean, I feel like I've stuck record halfway through the day because I'm just saying the same thing over and over and over to my patients. A correct warm-up, a correctly executed warm-up is worth its weight in gold. Muscles generally don't like being stretched cold. They don't like for you to drive to your run, get out of your car and start yanking on your quad to make it nice and long. They don't enjoy that. Muscles need to be warmed up dynamically. So you see the guys before a run, if you watch them on TV, if you watch the guys at track, they'll do things like butt kicks and high knees and pendulum swings through the legs, that kind of thing too. Toe walks, heel walks, those things all warm up the muscle and dynamically stretch the muscle. So instead of doing something like a static stretching, standing there, grabbing your foot and pulling it back to stretch your quad, we do those butt kicks, which dynamically and actively open up those muscle fibers and get those muscle fibers gliding. That's how you want to warm up before anything, even before a short run or a tempo run or a track run, whatever you want to do, or a cycle. You need to warm these muscles up and get them ready. You can't just put on your running shoes and start going. Yeah. You need to give them a good warm up. Even more important, arguably, is your post-exercise routine. You need to, firstly, get the correct nutrition as quickly as you possibly can. Get those branched chain amino acids and those building blocks of muscle fiber so that your body can start repairing the muscle immediately, straight after your workout. So you finish your workout and you bang your recovery shake, your L-glutamine, your raw proteins. You put that in as quickly as possible, and then you stretch while you're still warm. And the trick with stretching, the most common mistake that I see with stretching is that people stretch for too short a period of time. So they'll stand there and they'll do the traditional hamstring stretch. They'll go down, touch your toes, and they'll hold it for 10 seconds. The literature, again, that varies, is telling us that it takes us between 15 and 25 seconds for a muscle to relax into a stretch. We're only holding it for 15, so you've actually achieved nothing. You need to stretch these muscles for 45 seconds to a minute to actually gain some length in those fibers. And that's incredibly important, because what happens when you're exercising at a high level is you start to get adhesions and contractures between the muscle fibers themselves. And that affects the functioning of that muscle. So if your muscle fibers are not gliding, that's how muscle lengthens and shortens. The fibers glide along themselves. And if those fibers cannot do that, you're essentially affecting the ability to contract of that muscle. And if a muscle cannot contract, a muscle cannot be functional.
Yeah.
It's not doing us any good. It's not pushing us down the road. So that's probably the most important things. Warm up dynamically before, stretch immediately after, make sure that your nutritional intake is correct afterwards. And foam rolling is another one that's worth its weight in gold. Later that day, the next day, foam rolling is self-massage. You're using your own body weight to massage your fibers and lengthen the fibers within the muscle. So foam rolling is a phenomenal tool where you can go to Sportsman's Warehouse or Discount and buy a 200 rand foam roller, take it home and you have a massage therapist in your tea room where you can sit and roll every evening before you go to bed. It's worth its weight in gold. So those things I think are probably the most important thing for our athletes. From a general point of view, obviously if there's a massive fallout, if you hurt yourself, you need to pick up the phone and phone your practitioner and say, listen, this is what I've done, what am I doing? What do I do here? But I think for the general niggle and ache and pain and that kind of thing, if you keep to those fundamental rules, you're at a good start.
Okay.
Yeah.
Fantastic. Thanks. So that's that's really, really important information for everybody who's going to come in and actually give us a go. So make sure you're okay, train hard, but still, listen to your practitioner and he will guide you. So if anybody actually needs any help with anything, please get in touch with Dr. Matt Franzsen. At where?
So we have two practices, one in Cradle Park and one in Kailami. If you just throw Pure Symmetry into Google search engine, it will come up, either one of those practices. And our receptionist is there at the end of the phone all day to receive calls and slot you into a diary.
Great. So thanks so much.
My absolute pleasure.
We'll see you in November.
Absolutely. Thank you for making such a cool race for us.
Pleasure. See you soon. Thanks, mate.